Do you know there is a hidden superhero in your neck? It's like a tiny butterfly below your Adam's apple. You can't feel or see it unless there is something wrong with your body. But it is super important to keep your body balanced and your cells healthy. This hero controls your metabolism, which is nothing but how fast your body uses energy from food. So how does this tiny superhero control your body? Think of your hero like a little factory inside your neck that makes special chemicals called hormones. These hormones are like messengers that tell your body how fast or slow to work, kind of like a control panel for your metabolism. By now, I know most of you guys have probably guessed it. It's none other than our thyroid gland and its hormones. And if you're curious to learn more about health related stuff, hit that subscribe button for more eye-opening insights into your body. Let's explore why thyroid gland is such a superhero. Previously, I said your thyroid gland is like a little factory that makes special hormones called T3 and T4. Now, here's where it gets interesting. Your hero needs a special ingredient called iodine to make these hormones. And where does it get this iodine from? Your body takes iodine from the food we eat. From there, the iodine goes into the bloodstream and then a thyroid gland grabs it like a prize. This iodine combines with a protein called thyroglobulin, which is already present in the thyroid and forms T3 and T4. T4 and T3 are like superhero duo, but T3 is the real MVP because it is the one that does most of the important jobs in our body, like making sure your heart beats regularly and your brain works properly. Now, here's the surprise twist. Even though T4 is made more by your hero, your body has a clever trick up its sleeve. It can turn some of that T4 into T3 right where it's needed, that is your body cells, to make sure you have enough T3 to keep your body running smoothly. But wait, what if your body needs sometimes more, sometimes less energy? If the factory continuously releases T3 and T4, what if we need more at some places and what if we need less? And how does our hero know when to speed up the release of hormones or when to slow down? How will that happen? Our body has one more trick up its sleeve. Meet the pituitary gland, the behind the scenes maestro calling shots from our brain. It sends out a special messenger called TSH, that is thyroid stimulating hormone, which is like a wake up call for our thyroid gland. It's like a secret handshake between these two glands, making sure our energy levels stay just right. But the thyroid isn't just about energy. It also plays an important role in our heart function, influencing our heart rate and how forcefully our heart has to contract to pump the blood throughout the body, which is nothing but the force of contraction. And also it impacts your respiratory rate, ensuring you breathe in enough oxygen required according to your body's needs. And during fetal development and early childhood, it's essential for brain growth and maturation. And that is why it is important for pregnant women to always keep an eye on your thyroid by appropriate tests. Its influence doesn't stop there. When it comes to your reproductive system, the thyroid plays a vital role in maintaining a normal sexual function and your menstrual cycle. It even has a say in your sleep patterns and thought process. For example, when thyroid hormone levels are too high in your body, it can lead to fast thought generation but decreased focus. It's like 1,000 ideas buzzing around in your head but struggling to concentrate on any one of them. Sometimes, like any superhero, the thyroid gland can have its moments of overactivity called hyperthyroidism or underactivity called hypothyroidism. And that's when you start noticing some uncomfortable symptoms. But wait, I have one question for you all. Do you think we are all at risk for thyroid abnormalities? What makes some of us more likely to have them while others don't? Let me break it down for you. Anyone at any age can be affected, but those who have a family history of thyroid abnormalities or autoimmune conditions like type 1 diabetes mellitus, rheumatoid arthritis, or lupus, or those who have iodine deficiency or excess iodine intake, or who have exposed to radiation or certain chemicals, especially women and older individuals are at risk. Now, let me explain those symptoms in a simple way. Remember, in hypothyroidism, everything is hypo, that means low, like your thyroid hormones. So you have reduced metabolism, heart and muscle strength, and muscle activity. First, reduced metabolism means less energy is available for your body cells to function properly. So you feel tired all the time. And reduced metabolism makes it easier to gain weight even with the normal food intake. Reduced metabolism means less energy as well as less heat production. That means the individuals feel cold more easily than others even when the weather is warm. Thyroid hormones help in growth and maintenance of your skin, hair and nails by stimulating the production of keratin, a protein present in your hair and nails. So when you have low thyroid hormones in your body, that results in decrease in skin moisture. As a result, you'll have dry and flaky skin, hair breakage and brittle nails. These hormones affect all the muscles in the body. For example, let's go with tummy muscles. So if your hormone levels are low in the body, that leads to the decrease in the movement of tummy muscles. As a result, you'll have constipation. Next, if there is decrease in movement in other muscles of the body, that leads to muscle aches and joint pains. They also influence the production and function of chemicals in the brain that regulate your mood, sleep and thought processes. So when these hormone levels are low in your body, your overall brain activity is also low. That leads to the feelings of depression, mood swings, reduced memory and overall mental activity. Low thyroid hormone levels also causes hormonal imbalances in ovary, leading to irregular periods or heavy bleeding. In this, everything is hyper, that means high, like your overactive thyroid gland with its raised thyroid hormones. And so there will be increase in metabolism. That means your body burns calories faster, leading to weight loss, even though there is an increase in your appetite. Increase in metabolism means increase in heat production. That means the individuals feel hot more easily than others, even when the weather is cool. And when your body attempts to cool down, there will be increased sweating. When it comes to skin, hair and nails, you'll have warm, moist skin, and also there will be hair loss. Your nails become brittle and prone to breakage. When it comes to muscles, there will be overactivity in the muscles of the body. So in tummy muscles, it leads to diarrhea, while in other muscles of the body, there will be increased breakdown in muscle protein that leads to muscle weakness. Thyroid hormones also influence your heart rate and the force with which it has to contract to pump the blood throughout the body. So whenever there is an increase in thyroid hormones, you'll have increase in heart rate and increase in force of contraction, causing palpitations. As I've already mentioned, thyroid hormones also influence your mood, sleep and thought process. So whenever there is an increase in thyroid hormones in your body, there will be increase in overall brain activity, leading to anxiety, tremors, irritability and insomnia. They also cause hormonal imbalances in the ovaries, leading to irregular periods or little bleeding. So now we know the symptoms, but how do we know if it's because of a real thyroid issue or just we are having a bad day with weird and random symptoms? Well, there are a few clues we can look out for. Firstly, we can visually check for any swelling or weirdness in your neck area. You can even touch it gently to feel for anything unusual. But for confirmation, doctors often recommend a blood test called TFT, that is thyroid function test, in which we can measure TSH, T3 and T4 levels in your blood. Okay, you've given the blood sample and now you got your test results. But how do we know if it's normal or something going on in your thyroid gland? It's a bit confusing, but let me explain it to you in a simple way. Think of TSH, that is thyroid stimulating hormone, as a messenger that tells your thyroid gland to get to work. In hypothyroidism, the thyroid, our superhero, is underactive, so it releases less hormones and thus we have low T3 and T4 values. Okay, now our body realizes this and sends out more TSH from the pituitary gland to kickstart the thyroid into action, and thus we have high TSH values. So in hypothyroidism, T3 and T4 are low and TSH is high. In contrast, in hyperthyroidism, the thyroid is overactive, so it releases more hormones and thus we have high T3 and T4 values. Again, our body realizes this and the TSH values are lowered. So in hyperthyroidism, we have high T3 and T4 values and low TSH values. But sometimes things can get a bit tricky, especially with subclinical conditions. This means you might not have obvious symptoms, but there might be underlying thyroid abnormality, which if left out can lead to full-fledged thyroid abnormalities. Hey, don't you worry, because we still have clues to detect these minor things. For example, in subclinical hyperthyroidism, T3, T4 levels are normal and that is why you don't have any symptoms, but TSH levels are low and that is our clue. And in subclinical hypothyroidism, TSH levels are high even though your thyroid hormone levels are normal. To get a closer look at the thyroid gland, doctors might recommend ultrasound of the neck. This helps to differentiate between different types of abnormalities, like whether the thyroid is solid or filled with fluid, or whether there are any signs of cancer. And if the cancer is suspected, A biopsy might be necessary for confirmation, which is nothing but taking a small sample of tissue from your thyroid gland and checking it under microscope for any signs. Now you know how tests are done. In case if the test is positive, let me explain our treatment options. Depending on severity and other factors, doctors might suggest you medicines or surgery or sometimes only lifestyle changes. Once the treatment begins, it's important to keep an eye on things with regular checkups and blood tests to make sure your thyroid levels stay in balance. Remember to take care of yourselves both physically and mentally. Stay healthy, stay happy, and keep smiling through it all.